increase in vaccines, lots of controversy. So we're going to talk about one of the leading causes of deaths is congestive heart failure as we get older, and what you can do to actually treat, prevent it, and what are viruses doing and what are vaccines are doing. So the team's put together really a wonderful update. So I'm really looking forward to this. Take it away.
All right, here's a little bit of a table of contents of what we're going to talk about today. How your heart is damaged by different viruses, mainly respiratory viruses, COVID and flu. What's the evidence on vaccines for them both, specifically for heart failure patients? How to prevent it, as Dr. Curnew just said. How to prevent infections. Infectious disease, one of the biggest things you want to do is to prevent. So we're going to talk a little bit about that. And actually, the first thing we're going to talk a little bit about scientific confidence, how science works. I think it's a very important conversation to have, especially in this sphere. So let's go to the next slide and start that conversation. Actually, before that, reminder, non-adherence to medications is actually one of the biggest reasons for heart failure hospitalization. And so whenever you come to clinic, if your loved one has heart failure, it applies to everybody, but especially more important in this demographic of patients, always bring your pill bottles. We just want to minimize mistakes as much as possible. We actually have a webinar on prescription renewals as well on the channel. Please check that out as well if you've had multiple renewals, just to get a little bit more information on that topic. Okay.
This is actually
Beautiful.
extremely, extremely important. As that
Yeah.
I hear people say, "You should know. I told you that last time." You're asking for a medical error. And if you look at research on the area, first of all, about 50% of people stop or don't take their pills properly, number one. Number two is that you're getting input from lots of different people. Um, and if you look at electronic medical records, one of the weakest areas are medications. So we really spent a lot of time and effort trying to get your pills right. These are life-saving medications that make a huge difference. And so always know what you're taking. Always keep a list aboard. When you come see me, bring the pill bottles every time, every visit. This is your life that's important. I'm blessed with so many great students that are just being pill detectives, and they're going to check things out as much as we can. And you should have somebody in your family as your pill detective to make sure everything's on track. Pharmacists make mistakes. I make mistakes. You make mistakes. Let's make less of them. Thank you. Tell us more.
Exactly. Yeah. Again, you don't want to run out of gas, right? Same thing with pills. This one I really like, checklist. We have this checklist in the waiting room. We recently put it up, but pilots use checklists all the time. Not many experts do in their fields, but they do. So we can take examples from them. Make your own checklist coming to the clinic, or just use the one we have here. We have some extra time waiting in the waiting room. Look at your email and see if you can fill out that ocean form. Give us a little bit more information about the changes to your health, your pills, etc. So just wanted to tell everybody about this. Use checklists. They're amazing. They prevent mistakes and errors.
So this is actually very important. We're going to go through this a little bit over here. So what I just put a bunch of binders in front of you. I want everybody to now have a binder. Get a notebook, go to the dollar store, whatever you want to do, and just complete it, bring it in all the time. You can put your medication list, bring the pill bottles, bring the pills. Ocean is basically a way we communicate with you. If we have your email, we're going to send out a form before your next visit that asks you to complete. You can actually even print a copy for yourself if you want to on your computer. Just put the print button there and you have a copy of that. It allows you to figure out what's important to you and give us information. So please fill that out. Also, is that, do we have all the right information? The pharmacist has changed. My doctor has changed. I changed my number. I don't have, my home phone number. I don't have actually a house phone anymore. I use my cell phone. My wife decided we don't want that. Do you have that? Which is the best way to get a hold of you? Today, for instance, I was looking at Holter monitors that were coming back, and someone had a very bad Holter monitor. So I got on the phone and called them up. Just imagine I had the wrong phone number. So make sure we're updated in that circumstance. Write down what your questions are, and we can prioritize what's important to yourself. You got to know your blood pressure. Go to the pharmacist, get a machine, ask Santa Claus for a blood pressure machine, and measure it. And being educated learning about information, we forget, I was with an expert on education yesterday, and she reminded me is we all like lectures, but we don't, it's not the greatest way of learning. We forget. And so you need to practice, do things, measure things, pause. And 30 days to healthier you, do that 100 times to get better at this. I'm trying to fly in a plane glider. And before I go up into the plane, I got to go through my checklists every time before I land. I have to go through my checklist. This saves lives. And applying this information, your checklist will save lives. So I value your life. I hope you do the same thing too as well. Um, Tell us more.
All right, let's talk about science now, the complex world of science. So we want to start with a little bit of an analogy, probabilities. So life is all about probabilities. In science, a lot of times we have categorical thinking, black and white stuff. But when you think about everyday decisions, let's take it, the ones on the right, for example. How confident are you that your new winter tires would prevent a crash on the highway? It's just a matter of odds. It's not 100% risk reduction, right? But you stack the odds in your favor. Same thing with deciding, should I have winter boots on today or gym shoes? Am I going to slip or not? Life is full of probabilities and risk, and your decision is to not play dice, like Einstein said here. So humans do. There's randomness, and you're in control in some of that. So control what you can. So let's go to the next slide. Things like vaccines, preventative medicine, things like that. They're huge because science is also about probabilities. I love this quote by Dr. Osler: "Medicine is a sign of uncertainty and an art of probability." Right. So it's all about different layers that you add to minimize your risk, whether it is the mask in certain settings, or the filters, or keeping your distance, etc., etc. So just keep this in mind. Categorical thinking is not always the best way to communicate complex things. So let's keep that in mind. And let's go to the next slide. There's another, I love this quote. So I think many times people make claims online, even in our daily lives, we make claims, but it's a good point when we think about this quote: "In God we trust, all others must bring data." So I love this. So in science, confidence rises with data. So the more data you have, the better data you have, your confidence goes up. It doesn't mean something works completely or it doesn't work completely. It's all about layers of confidence, levels of confidence. That's really important to say. It's a spectrum. Okay. Let's go to the next slide. There's a spectrum of confidence. So if you look on the left, we have different study types for you. The bottom, the right one, we have animal laboratory studies. That's mice, some animals. That's the lowest level of evidence generally, because you can't apply directly to humans. And as you go up, you have more people, you have studies with less limitations, like randomized controlled trials, where you randomize people 50 to placebo, 50 to a pill. And then you have systematic reviews and meta-analyses, which are pooled studies. And you're going to see a few of that today, actually, where scientists and non-scientists actually, they take studies and put it together to try to give you a bird's eye view of the evidence, right? Because sometimes you have, on fish oil, for example, you have one study that says they're useful, one study says, doesn't give you any benefit. But systematic reviews, they're not all better all the time than RCTs, but they give you a big picture view. And if you look on the right, just a spectrum of confidence. So if you have mechanistic evidence alone, something we found out from my study. So that's low confidence. You can't use it in humans. It doesn't mean it's not true. It doesn't mean it's true. It's just lower confidence. You had observational studies, slightly higher confidence. You have randomized controlled trials, a little bit higher confidence. And then the other thing is there's something called totality of evidence. We put things together, observational plus RCTs plus mechanistic evidence. So for flu, for example, we're going to get into this a little bit later, but you look at the whole picture together to see what the evidence tells you, because it's a little bit confusing to try to figure out, do I need a booster? Do I not need a booster? What's the efficacy of vaccines, etc. So you look at the whole big picture, and generally more data is better. Quality of data matters. But again, I just want to reiterate, there are rare certainties in medicine, just varying level of confidence. So for example, statins reduce heart attacks. That's high level of confidence, right? You could say it's 100% true, but if you start late, for example, in your 70s, lower chance of preventing the first heart attack, for example. So it's just low, moderate, and high levels of confidence. Just want to reiterate that point. I think that's a very key point in today's webinar. Anything to add, Dr. Curnew?
Yeah, so if my next door neighbor says that vaccines are bad for you, I had a bad reaction, what level of evidence where would you put that into place? How would you
It's,
put that?
yeah, anecdotal evidence. Exactly. So if you actually looked at the orange part, so you have expert opinions, you have editorials, narrative. So that's, anecdotal evidence. Case reports. That's the scientific word for it. It's
Okay,
just n equals one. It's just one sample. Yeah, it doesn't give you much. It's important. It's effective. That's what people remember. But you
so the
have to look at the
level
whole
of
picture.
evidence would be down that orange case report. Can put an arrow where that case report is over there. Um, and those are by non-experts. So, experts send in case series and things of that nature as well. So that's the lowest level of evidence. And I think it's
Oh, good.
important is that in medicine, we're taught to be skeptical about information, how to
Yeah,
analyze information. Um, and so to get opinions from everywhere, but I'm kind of wondering is that who should you get your evidence from? And so I try to
yeah,
find as much as I can from the totality information as you mentioned. Obviously,
yeah,
meta-analysis, randomized trials, but also from experts in the field who know a lot more about that than I do in
yeah,
areas. So you should too. Um,
yeah, yeah. So I quickly add a point to that. The thing with COVID is that, not just COVID, even experts look at a group of experts. So guidelines gave you that because you have some experts who may have not looked at the data. Expert can be wrong, even the experts in their exact field, very highly specific field. So again, even for that, you want to look at a few experts, try to see what the consensus is. Because unfortunately in COVID, I think we've learned that some experts can get some things completely wrong and to the point of sometimes intentionally going the wrong way. So that's important.
and also evidence changes, so we change our minds. So there's lots of
Yeah,
uncertainties, and we keep changing about this. So you want certainty. Well, you quote Osler, is making sense of the totality information, and that's what healthcare providers do. So take it or leave it. I'm gonna take people who know a lot about that and devote a good part of their life to it. Tell us more.
exactly. All right. Let's go to the next slide. All right, just quick, this is a little bit quick of an introduction. So today you're going to see some of this confidence. So we talk about confidence. So just going to introduce what this is. Risk ratio, that's a level of saying how likely something is going to happen to you. So for example, here we have 2.33 times the risk of in-hospital mortality. And then on the right, you usually see a confidence interval. So it's a range that this value falls in. So 1.69 to 3.21. We're 95% confident that our value falls in this range. So that's where confidence is a good example of confidence in medicine, right? We give you a range of the lowest, the maximum. And there's also something called a p-value. I'm not going to go into details on that, but essentially the lower that is, the better. Essentially, if it's low, it means very little of the difference you see between group A and group B is due to chance. Because, if you can put your hand in a jar of gummy bears and you take colors out, just by chance alone, you can have differences between those two different sample sizes. So the lower that is, the better. Okay. Then we can go to the next slide and talk a little bit about flu. All right, this is a good point. Can I still get if I can still get the flu, why bother with a vaccine? So a lot of people think like this, but it's not all about preventing infection. Same thing with COVID vaccine, actually. It's about reducing the severity of illness, hospitalization, and death from flu or COVID. This is more important for people at risk. And some people, you don't know always if you're at risk. COVID taught us that there are a lot of people with seemingly no comorbidities or lower ages, and people in their 40s or 50s who still passed away, who still go into the hospital. Same thing happens with the flu. So again, with the probability idea, you don't want to take your chances. It's something to consider. The second reason, if you actually look at the highest comorbidity recorded on death records in the CDC from 2020 to now, the highest one is as a co-infection with flu and COVID together. So that's the highest one. So you don't want to get co-infected. So that's another reason to get the vaccine, to reduce your chances of having two respiratory infections together, because even if you're supposedly young and healthy, it can give you problems. And the last one, that there's some evidence, not super strong, moderate confidence, that vaccines for flu can also reduce major adverse cardiovascular events like heart attacks and stroke and cardiovascular death. So that's a little bit of a plus for that. Reduce your chances. Again, it's all about putting the odds in your favor. Okay. Anything to add here? We're good. I think let's go to the next slide. Just want to show the CDC data. So again, influenza and pneumonia accounted for 46.4% of total deaths. That's total. I actually looked at all the other years. It stayed the same. The numbers changed, but it stayed the same. Second one, hypertension, diabetes, Alzheimer's, and dementia. That would probably not be directly associated in terms of a causal direct cause, but people who have Alzheimer's, age is higher, so that's another reason. And you have sepsis. But again, the first thing you see is influenza and pneumonia. So what you want to do is reduce your chances of getting co-infected, and not just influenza, other respiratory infections as well, RSV, et cetera, et cetera. So again, it's all about probabilities and reducing risk overall. Okay, that's quite important. Go to the next slide. Right, this is a very good summary of how your immune system works. So you have 3 layers of defense. First one, when you first get infected, is what happens a few months, few weeks after you have the last infection of COVID or your last booster. You have antibodies in your system, and so you pretty much have infantry ready to fight off an infection. And that's why effectiveness against infection in the next few months is quite effective. But variants come along, and the antibodies that you make, and actually the memory cells, you have memory cells that remember these antibody codes. They're less effective against the new variants. And that's what we have so far. We've had boosters for COVID, because in the middle, you have memory B cells. They make antibodies when you get sick. The soldiers, they neutralize the virus. But again, the older antibodies that you have, even if you have the memory, they're just less effective against the new variants, to the point where for some people, not having these soldiers is not enough. And then you have the killer T cells, the ninjas, so to speak. They directly kill the infected cells. These are still protecting a lot of people, especially younger people. But again, for a lot of people, you need 3 layers of defense. If you get rid of the first 2 and you just have the last 3, you have less protection. And for a lot of people, they can lead to hospitalization, just severe illness, even if you don't go to the hospital. And in some cases now, a little bit rare now, and death. So just 3 layer protection. Just want to keep them all up, keep the guard up. It gives you a good insurance policy. Let's go to the next slide. Just want to show that vaccines, the immunity you get wanes over time. And that's partly because of the antibody levels that go down. Again, your T cells, your memory, you still have memory against them. But if the virus changes, the antibodies just work a lot less. And so that sometimes for some variants, they can work not enough to the point where you need boosters. Okay. And that's where we are right now. In 2024, 2025, the evidence is probably going to be different. Maybe not. We might have variants that don't change much, and maybe less and less people will require boosters because they have prior immunity from the prior vaccines, right? But again, as everybody said, evidence changes, and that's what we go with. We don't try to memorize something from 2020 and infer relationships in 2024, for example. So it's important to mention that. Okay.
So this is actually for COVID, different immunities for different pathogens right now. So it looks like for pneumococcal disease, for instance, you get actually long-term protection. Polio, you get long-term protection. For COVID, it's actually important is that we have different immunities. So the people that are getting the sickest right now are actually the very young, the babies, for instance, who first presentation of COVID is not the is harmful to them, and they have an immature immune system. And as you get older, your immune system starts to fall apart. Unfortunately, as you get older, is that I'm more susceptible to getting shingles at this point in time, to complications of influenza, complications from pneumococcal pneumonia, complications from COVID. Now, COVID has changed, which is a good thing, is not as deadly. Good news. Number 2, it just lines receptors called AT receptors that lines all your blood vessels. So it repeatedly injures your vessels and body, your brain, your heart, your pancreas, all sorts of systems right now. And it looks like after about 6 months, we've lost a fair bit of protection, as you see on your slide here. So different strategies, but the strategy that I've adopted right now is that every 6 months, I'm going to get a vaccine right now, and if I can get one, and updated vaccines if that's possible. All you're doing when you're getting a vaccine, you're getting a little piece of the virus, and like anything in life, is that my memory for what happened in 6 months is pretty bad. Your immune system for COVID, same thing. It has cells that have memory T cells that remember things, but it doesn't remember everything, and it loses that protection, and those antibody levels fall, those protective effects fall over time. So you can decide what you want to do. But this is not an unreasonable strategy, and we're going to learn more. And I'm privileged to talk to a lot of smart people, do lots of readings, and but I read a lot of information from experts as well too. So I really like this slide saying that maybe in young people your protection lasts longer.
Yeah.
For now, for high risk people, and that's when people at the age of 60, 65, it's not a bad strategy. I'll remember is that COVID likes to go into plaque in the arteries. So if you already have blocked arteries, we know that you're much more likely to have a heart attack in the first few weeks after major infections, including COVID. And so that's one thing to look at. Thank you. Tell us more.
Yes, let's go next slide. There's a good analogy that we decided to include. Again, with the idea of probabilities, if you decide to get a booster or not get a booster, if you get a booster, it's a little bit like changing your tires. So you can still, I mean, with the right tire, it's pretty terrible right now. You can still go on the highway with that, and you might not get into an accident, but there is a risk, right? So, but with a left one, you can restore your protection, just like how you change your tire every now and then, every few years. It's a bit of an insurance policy. Again, you just stack the things, the preventive measures in your favor, and see what happens. That's the idea, right? Again, for as Dr. Curnew said, for younger people, you might have immunity from your T cells, the ninja killer cells. And for some older people, you need those soldiers ready to fight off an infection. If they're not ready, it's just going to take you longer and more severe infection, plus the other effects that we mentioned, its impact on the brain, on the heart, your vessels, etc. Again, so just an insurance policy you have from boosters. Okay.
So when someone
go
says
to-
to
yeah.
you that I got the flu shot, but I got the flu afterwards, most of the time you didn't get the flu, you got the common cold. And with the influenza vaccine is somewhere between 30 to 60% effective, depending on the year. It softens the blow. It's giving you better tires.
Yeah.
Doesn't mean you can't have an
Yeah.
accident. If I see
Exactly.
somebody sick, I'm gonna wear one of these, run the way, wash my hands, not touch my face, and do all those preventive strategies. And we have HEPA filters in our office. You should get one for your house as well. And so tires don't prevent accidents or don't stop all accidents, but they prevent a lot of them. It's the same thing with vaccines. So I love this picture. So think about over time your immunity wavers for certain diseases, COVID in particular. And you want to, in times where lots of COVID's around, you want to have bald tires or you want to have good snow tires. So it's up to
Yeah.
you. Vaccine gives you good tires.
Exactly. Exactly. All right, let's go to the next slide. This is something that some patients and some other people share. So they say chasing variants is a good point. But so far, we know that the updated vaccines actually just came out yesterday. It's a preprint study, so not peer-reviewed yet, but still gives you a good evidence. There's a study, a clinical study, looking at COVID hospitalization and ICU admissions in Netherlands between October 9th of this year and December 5th. And we can see that the vaccine, the XBB 1.5 against the new circulating variants, it showed pretty good protection against severe disease, which is the goal of this vaccine, just like the flu vaccine. So this is for COVID, 71 protection against hospitalization, 73 against ICU admission, restored protection. And with good sample size as well, about 2,000 people. Again, it's early data, but so far we know that the last vaccine is still the updated vaccine is still being effective against the circulating variants. Again, that might change. Hopefully it doesn't, but I guess we'll see and learn as we go.
So it's interesting. You trust Eric Topo. He's a world's expert. Do you trust your next door neighbor or your local pharmacist or myself, whatever? Eric Topo knows a lot more than I do. And so we look to people who are experts in this area. You should too. Tell us more.
Yeah, that's exactly. And the fact there's a citation people can check. That's amazing. All right, now let's talk about how viruses damage your heart. We'll pass it away to Jana. Take it away and tell us a little bit about this.
Yeah, so heart failure is becoming more prevalent, and factors like infection from viruses and bacteria can impact the development of heart failure. So managing medical conditions caused by pathogens is important. So here on the slide, we have a great illustration of the heart. On the top image, we see healthy heart muscle and heart muscle cells. And on the bottom image, we see inflamed heart muscle, which happens after infection. We also see immune cells that are trying to fight off the infection. So some ways that the heart can be damaged by pathogens is through immune-mediated effects, meaning that when the immune response is trying to fight the infection through inflammation, the immune system can overreact or attack the body sometimes. Another way the heart can also be damaged through direct infection is through disrupting cell function. And also immune suppression could also lead to heart damage. And then on the next slide, continuing on with the topic of pathogens causing damage to the heart, here's just, sorry, next slide. There's just a list here of different viruses that are commonly associated with myocarditis, also known as heart inflammation. Sorry, could you go back to the previous slide? Perfect, thank you. So yeah, when looking at the cascade of events after infection, we start with phase 1, where the pathogen infects the heart, and this can lead to cell death and heart damage. And then in phase 2, like we mentioned before, the immune system is trying to fight the infection, but in turn, this can cause some damage to the body. And then finally, in phase 3, we see chronic disease or resolution. So if the immune system reacts normally, then the immune response and inflammation starts to go down and the body recovers. However, sometimes the immune response doesn't go down as expected, and we see chronic inflammation and other complications. So on to the next slide, just to summarize everything. There are a lot of different ways infections can affect the heart. This is often under-recognized, but should be accounted for to prevent cardiac complications. And then on to the next slide.
Go back one slide.
Now that
Let's go back. So this is actually very interesting. This is what atherosclerosis is. So right now we have a virus that gets into goes through the blood cells, but it goes through the AT receptor. It lines all your blood vessels. It goes into the heart. Then you have the fight, your white cells. This is a monocyte becomes a macrophage, and a war is going on there. That happens when you get COVID and many infections. Then the body has to heal itself. Does it heal itself with permanent scars or not? Do you get totally better? The more often this happens, the more injuries. Concussions to the head has been something that I probably banged my head too many times when I was younger, different sports, and I'm going to pay a consequence for that. We know that cholesterol gets into the arteries, and we know at the age of 20 years of age, somewhere between 17 to 70 or to 50% of people already have some degree of blockage developing. If you're over the age of 60 years of age, 90% of us have some degree of blockage formation in the vessels of the heart. And so, blood pressure damages, smoking damages, diabetes damages, viruses damage, bacteria damages, cholesterol damages. So I want as little damage as I possibly can. And as you mentioned before, are you going to have bald tires to protect you, or are you going to have good snow tires to protect you when the snowstorm of different insults to vessels? And COVID likes to go into heart cells, into these plaques and things of that nature as well. It likes that place. So think about how you can actually do something about it. Tell us more.
Yeah, for sure. Now that we've covered how infections affect the heart more generally, let's get into some more specific topics like COVID, which is highly relevant to heart health. So just as an overview, looking at COVID in Ontario right now, we can see the graph from Public Health Ontario that COVID hospital bed occupancies have gone up quite a bit over the past couple of months. So from July to November, you can see that it's jumped from 200 to 1,700, which is quite a bit of a jump. And then on the next slide, we can see that in Hamilton, COVID hospitalizations in October also increased, and they're still pretty high in comparison to all of the other months previously. And then on the next slide, we can see that COVID hospitalizations mainly consisted of patients who were in younger and older age groups, so more vulnerable populations. So taking this all in and looking at all of these trends, even though the World Health Organization no longer qualifies COVID-19 as a global emergency, it doesn't mean that COVID is no longer a threat. There's still the risk of new variants as well as long-term effects to keep in mind.
So a lot of parents are choosing not to vaccinate their kids. I'm not so sure that's a good idea. We know when you're very young, you have a weak immune system. You get some immunity from breast milk. And as you go to school, you get more exposures to infections. So kids who go to daycare always have the sniffles and getting sick. You remember that slide before about atherosclerosis and invading body parts? I would reconsider strategies about vaccinations. And as we get older, our immune system doesn't work as well. So by not being vaccinated, you expose yourself to higher risk. And as you get older, your immune system doesn't work as well. You need extra protection. A good Chinese proverb, a good doctor treats disease, a better doctor prevents disease. So you want to be a better parent, you want to be a better patient. Those are things you can consider. Yes, there are potential side effects. They're quite small. And if you see all these graphs of COVID going up, I'm kind of worried. I'm seeing a lot of COVID, and I hope it's not going to cause a huge sequela to people afterwards. Tell us more.
So when looking at the effects of COVID over the pandemic, a well-known complication was respiratory failure, but COVID could also be linked to cardiovascular dysfunction. There are many potential mechanisms in which COVID could lead to these heart conditions, some being direct viral or immune-mediated effects, which we mentioned before. Some of the heart condition complications of COVID include heart attacks, heart failure, myocarditis, which is heart inflammation, cardiogenic shock, which is where your heart can't pump enough blood for all of the body's needs, and even potentially leading to cardiovascular death. Next slide, please. And then building off of that, here's a study which found that COVID infects blood vessels in the heart, that it could trigger inflammation in plaques that block the arteries, which is a term also known as atherogenic, and it also has acute and long-term cardiovascular complications. This evidence was found through human autopsies of patients with COVID and pre-existing heart conditions, but it wasn't done through clinical studies. So we just need to be careful about drawing clinical conclusions with this mechanistic evidence. And the next slide. A common question is, would I be at risk of developing heart failure after COVID infection? So let's take a look at some studies that cover this. In a systematic review with patients that were followed up for an average of 9 months, they found that recovered COVID patients were almost twice as likely to be diagnosed with heart failure in comparison to patients who were not infected within the same time period. The study also has some limitations like study design and limited data that should be noted, just when we're looking at considering the quality of evidence. And then I'll just pass it on to the next person.
All right. All right. So we talked a little bit about the effects, but if we look at the data, we talk about everybody should bring data. Let's bring data on what are the risk of bad outcomes after COVID in somebody who has heart failure. Let's go to the next slide. And so this is actually an overview. If you look at the comorbidities that many heart failure patients have, they overlap with COVID-19 comorbidities. So the main one is actually age, which is not on the slide, but that's the main one. But some of the other ones, renal dysfunction or CKD, chronic kidney disease, that's one of the for some reason is quite a significant risk factor for severe COVID-19 outcomes. And COPD is another one. Diabetes, as we saw in the earlier CDC data, it was being one of the third comorbidities on the death certificate. Obesity is actually one of the silent ones most people don't mention, because a lot of younger people in their 40s or 50s, obesity is a risk factor they have. They might not have the other risk factors like renal dysfunction, diabetes yet, but obesity is still a huge risk factor. And we see that quite a bit in severe outcome trials. So just to keep this in mind, the comorbidities overlap. Okay. Now let's look at some data. The next slide.
Actually, just
There
go
we
back
go.
one more time. Go
Go
back.
back? Yeah, go ahead.
Yeah, right here. You mentioned the sarcopenia. That means as we get older, we have less muscle and more fat mass. And
Yeah.
fat doesn't burn energy, so your caloric requirements go down. And one of the things that's really worrisome, and it's something that I have not paid enough attention to until the last year or so, is that as we get older, we lose somewhere between potentially 30 to 50% of muscle mass, starting the age of 40 onwards. It accelerates at 60 and 70. So I've started in April a fall prevention program and a dementia prevention program and a muscle building program. Now, I just have a milestone. I can do about 2 or 3 chin-ups without a band assist at this stage in life. That's kind of embarrassing. When I was your age, I can probably do about 25 of them. And and I encourage you to think about is I want to be as healthy for as long as I can. And a lot of the longevity experts are talking about is that the way to delay being in the nursing home and to improve quality of life, people who have the highest fitness are 4 times less likely to die for total mortality compared at the lowest fitness level. And so really think about building muscle and having fun doing it. If you want to join me, we'll do some stairs from time to time. That's not really going to build a lot of muscle, but you do weight bands, push-ups. There's one longevity specialist. He turns on the coffee machine in the morning time and does his push-ups until the coffee is ready. I kind of like that. I'm going to try to do something 2 to 4 times a week for just pure muscle buildup. And please do it as well.
Exactly. I think, yeah, muscles are underrated, especially when I work in a retirement home and I see this every single day where I keep thinking, comparing different people and say, what was how could you have prevented this? And I think, is this an inevitable part of aging? Having not the best of balance and then walking, etc. Muscles are definitely underrated when you age. Cardiovascular fitness, as Dr. Curnew just referred to, is another marker. It's huge in terms of longevity. The health span is something we forget about, and having muscles in the last 10, 15 years of your life is absolutely crucial. So don't forget about that. Let's go to the next slide and look at some of the data. This was actually interesting. Highly cited article from October 2022. They put different comorbidities together. And as you can see, the top left diagram, the patients with a higher risk were organ transplant patients. But you can see some of the in some of the red areas, you have COPD on the right, so you have diabetes, you have atrial fibrillation. So you can look at this and see which ones you have or your loved one has, and then you can look at your risk. And again, this is just one study. We want to look at the totality of the evidence, but you can see heart failure is at the bottom left, and it's increases your risk, right? And this is against hospitalization or death. Again, just a big picture overview of data. So takeaway, heart failure and COVID-19 are not a good combination. Same thing with other comorbidities, but especially this disease as well. Okay, let's go to the next slide. A little bit more data. So this was interesting. Relatively recent publication, December 2020, but they looked at 1.1 million hospitalizations for heart failure, and they found that 0.71% had COVID. Again, take that percentage with a grain of salt. Some studies report more, some studies report less. So that's not the most important thing. Data was from 2020. But what they found was that the COVID-19 patients who had heart failure, they had higher risk of in-hospital mortality, 2.33 times. That's the risk ratio we mentioned. Greater risk of cardiac arrest in the hospital, 2.21. And greatest risk of a pulmonary embolism, which is when it's quite fatal, that condition. And it's just when you have blood clot blocking one of the arteries to your lungs. So it's not something you want to have, absolutely. So again, it increases the risk of multiple bad things. And It's also important to say, again, this is from 2020, mostly unvaccinated. So the risk is a little bit different now if you've been vaccinated. But again, it just shows the risk. Okay, let's go to the next slide. And there we go. So this is the same study, just shows it to you visually. COVID-19 was an independent predictor of mortality in heart failure patients by 2.3-fold. Again, this is mostly in 2020. The risk right now, I don't want to speculate on the number, but it's a little bit different. Let's go to the next slide and zoom in on that bottom left diagram. So you can see some of the bad outcomes you don't want to have, as we mentioned, in hospital mortality. All the blue bar graphs, they're higher in COVID-19 patients than no COVID-19 controls, right? So cardiac arrest, sepsis, which is systemic infection, pulmonary embolism, respiratory failure, bleeding required transfusion, right? So heart failure patients are at risk. That's the takeaway message here. Let's move on. Again, same thing here. The study with 2.1 million patients showed something similar. Again, you can see the reason why I included this here is that you can see different levels of risk. So some studies show different, a little bit lower. The study shows 6.3 times the risk of in-hospital mortality. Again, the point is you look at the totality evidence, see what the ranges are. Again, you can see here the confidence interval for the first one, 6.05 to 6.62, right? And the other interesting of this study was that they compared the heart failure types. So heart failure with reduced ejection fraction and with preserved. And I don't want to speculate as to what the reasons are, but they found a little bit of greater risk in patients with reduced ejection fraction, partly because maybe comorbidities associated with that subtype of heart failure. Again, it was just interesting to see that. Just want to share with everybody. Let's go to the next slide. All right, now vaccines for heart failure patients. On this topic, what's the evidence of COVID vaccines for heart failure? Not a lot of evidence specifically on this patient group, but there was one good study, observational. Let's go to the next slide, that found good protection. So essentially, they compared people with heart failure in the early Omicron stage, only after 14 days, but it still gives you as we mentioned previously, 4 months, 6 months, you get protection. The protection wanes after that. But they looked at 14-day hospital admission and ICU admission, and you see the red line, that's non-vaccinated at all or not infected, because infection itself gives you immunity. The green one is vaccinated, and then vaccinated plus boosted, the risk goes down, right? So this is good evidence in heart failure patients. Again, we put the word may in the takeaway here. Heart failure patients may benefit from boosters to restore their protection against severe disease. The reason we say may is because individual risks can vary, and we just want to reiterate that confidence and probability idea that we mentioned. But again, you just want to stack the odds in your favor and see what happens, okay? Let's go to the next slide. All right, influenza time. Let's see what the story is on this one. Let's go to the next slide.
All right,
All right, I'll pass it off to Siwan. Go ahead.
I'll take it over from here. So influenza is what we commonly know as the common flu. So this is a contagious virus disease that affects the upper respiratory tract and circulates around annually. So when we get a season flu, it's against the influenza virus that we're protecting against. So influenza surprisingly causes considerable morbidity and mortality, meaning that affects a significant amount of people, and it also causes a significant amount of deaths per year. There are 4 main categories of influenza. They're organized by 4 different strains, A, B, C, and D. Strains A and B both contribute to the season flu, and they're probably the ones that we're most familiar with. Strain Cs are not as severe in terms of symptoms, and strain D typically do not affect human. Strain A also have a subcategorization, which we are likely more familiar with, that are grouped by hemagglutinin as well as neuraminidase. So the HA and NA, they're typically the H1N1 strain, or like the H15 and 6 strain that we might hear about on the news. All right, next slide, please. So we think about the season flu, we likely won't think of it as a really serious or a really disturbing thing. We hear about people catching the flu all the time. So that might have decreased our alarm on this. However, upon a quick search, that's actually not true. So there's a bit of stunning statistics that I found. For example, patients are 6 times more likely to experience a heart attack in the week after their influenza infection. And there's also other studies that found that within 336,000 hospital admissions for flu, 11.5% of those patients has experienced a serious cardiac event. And other studies using a similar population in different conditions found a similar statistic of 11.7% of patients experience acute cardiovascular events after their influenza infection. So this tells us that influenza can actually have a huge burden on our heart. And I wondered why. So I did a bit more research and I found, next slide, please. And I found that there's three main effects that acute infection has with respect to the heart. So the first sign is that it increases inflammation and vasoconstriction. And all this says is that the blood vessel that supplies blood to your organs as well as your heart gets constricted. So you get a narrower blood vessel, and this limits the amount of blood flowing into that organ. The second thing that acute infections propose onto the cardiovascular system is it promotes this procoagulation condition. So it promotes blood clotting, which is relatively a bad thing if it's within the vascular system itself. And the third thing that acute infection poses onto our body overall is it increases the metabolic demand. So it requires the body to burn more calories, and it requires the body to use up more energy to keep up with the same functions that it used to be able to do. So how does this all tie in with heart failure? Next slide, please. So the first thing that happens is the artery may be disrupted due to any external factors, and this disruption of the artery itself causes an exposure of what's called thrombogenic material. Thrombogenic material basically stands for blood clot generating material. So when a patient does have a disruption onto their artery walls, it causes the blood clot generating material to be exposed, and increased inflammation causes the blood vessels to narrow. So when the blood vessel is trying to form blood clots in a narrower blood vessel, it proposes a lot of serious issues. So next slide, please. So based on the condition of the environment, the blood clot may form, and especially with respect to patients who are experiencing inflammation as well as infection, they are also under what's called a hypoxemia condition. So this basically says that the blood, basically the conclusion is that blood clots are more likely to form, and they're more likely to coagulate and block up the blood vessel. Next slide, please. And when the blood vessel gets blocked by blood clots, what happens is the blood can't flow through that vessel. And when blood can't flow through that vessel, that section that the vessel supplies doesn't get an adequate blood flow. Hence, that part of the organ cannot receive enough nutrients, and it cannot perform its normal functions. So when a majority of the vessels, or when a big segment of the vessel gets clogged up, essentially that tissue cannot function. And if that happens to be on the heart, then the heart can't pump any blood. And this likely would cause the acute coronary syndrome, or also what we commonly call as heart attack. Next slide, please.
All right. This is a little bit of data of influenza. So if you compare it to last year, October 2022, January, actually peaked up in November, December. So not super surprising. So right now, when you think about it, it's probably, if you haven't been vaccinated, it's probably the best time. You get the maximum protection if you get it right now in the next few days, up until the holidays and the gatherings that we're going to have during Christmas time. So right now, it's just beginning to creep up. Let's go to the next slide. That's all in Ontario. This is a good comparison between how the rate of COVID going up and influenza. So if you look at the bottom right, September 2023, November 2023, but for some reason, this might just be testing, but I think this is mainly data from hospitalized patients. So whoever shows up with cold-like symptoms or flu-like symptoms, you have the test. And COVID seems to be in a bigger rise right now. And in terms of the dominant respiratory viruses, on the middle gray table right here, you have COVID at 18.9%, which is the majority by far. And then you have the influenza substrains, influenza A, B, and you have the RSV virus, right? So this is a good big picture of what's going on around, and COVID is still the predominant virus. It seems like influenza has been a little bit on the side for now, but we'll see what happens in the future, just to be on the lookout for this. Okay, it's going up a little bit. Let's go to the next slide. All right, so am I at risk of bad outcomes if I get influenza? So let's look at quick data from here. Next slide, please. Firstly, we spoke a lot about respiratory infections, but how about non-respiratory infections? So urinary tract infections, bacterial pneumonia. There was a study from Israel. They looked at 9,000 heart failure hospitalizations, and they found that 38% of the hospitalized patients had at least one infection, or it was mainly because of one infection. 38%, 52% of that was because of respiratory infections, but the other half was, sepsis from bacteria and urinary tract infections. Again, the takeaway here is you have the preventative strategies, wear a mask and vaccinate, but wash your hands whenever. If you work in a high-risk setting, for example, just remember this, that it's not just respiratory viruses that affect you. There are other ones as well. They can do damage. Now let's go to the next slide. Yes, this is from the same study. And we included this because if you look at the bottom, the risk factors, the predictors for such infections in order of magnitude, the biggest one was COPD, having a previous heart attack. That's another adverse factor. Having atrial fibrillation, having anemia, having cancer, chronic kidney disease, age. Surprisingly, male was a 0.77, a little bit of protective. Seems like females are at greater risk of hospitalization from heart failure if they're co-infected with viruses or bacteria. And this diagram here, it shows a 30-day mortality after infection from different infection types. So we can see bacteria seems to be the biggest one. Just take the magnitudes with a grain of salt here, but it just shows you that compared to no infection, how damaging the different pathogens are: respiratory, bacteria, urinary tract infections. Surprisingly, skin and soft tissue infections, which is a bit higher than urinary, for example. So just it's a good, interesting study to look at. Let's go to the next slide. I'll just skip a slide. There you go. Perfect. All right. So this is interesting. So this study, they looked at, it was an observational study in the US. If you actually go to the previous one, just want to show the data. There's something previously to this, Amir.
We're running a little bit tight on time. I can post the slides if that's all right.
Oh, sure. Okay, I'll cover this. So essentially it was observational. And they looked at the different times of the year where flu was predominant, and they looked at heart failure hospitalizations, and they were correlated. Again, in medicine, we say correlation doesn't equal causation, but if you, again, look at the totality of evidence, a big part of that is because of the flu, okay? So again, big picture data shows you that. Let's go to the next slide. Right, now for vaccines, in the case of heart failure patients, let's look at the data on this. Next slide, please. All right, so as we mentioned, systematic reviews and meta-analyses, pooled studies. So this had 9,000 people from 6 randomized controlled trials, so gold standard. Albeit some of the studies were not from recent. If you look at the bottom, 2004, 2008, the most recent ones from 2021 and 2022, last one being from McMaster, actually, and we'll see that. And they found the influenza vaccination reduced some cardiovascular events, so heart attacks and strokes. Lower risk of cardiovascular death, and lowered the risk of all-cause mortality. So this is good evidence. And the interesting thing was, it was after 6 months after vaccination. So a lot of times we think it might be a transient effect, but this shows a little bit of a different picture, that the effect could last a little bit longer as well. Let's go to the next slide.
Hold on. Go back one slide here.
Yeah.
In 2021, the AMI trial was done. This was a large randomized controlled trial that changed my practice of medicine. It's a game changer. It took thousands of patients on 3 consecutive winters and gave them the flu shot, influenza vaccine, 3 consecutive winters, and people who came into the hospital with a heart attack or suspected heart attack. And it decreased cardiovascular events and mortality. Look at this, 28% reduction in mortality. This is not an angioplasty. They got their therapy. This is actually the vaccination. You mentioned Jenna showed us that showed us that people get inflammation and they have a higher heart attack rate after getting sick. And all viruses, COVID does this too, influenza does this too, shingles does this as well, RSV probably does this too as well. It damages your vessels, and by being vaccinated in a coronary care unit, you had major impacts on cardiovascular events in the next year. This is important. So I think this is a game changer, and you just added some extra data. So thank you for showing that. I really, the more I look at heart disease, is that prevention is important. This actually makes people live longer. Just by having a heart attack is not a good thing, but having a heart attack and getting influenza is a bad thing. And this actually changes mortality, total mortality. It almost looks too good to be true, but this is the data. This is on randomized data. So keep telling us more. This is incredible information.
Yeah, absolutely. So there's the study, the last one we have. So from our very own Dr. Mark Love from McMaster's team. This is actually a 5-year study in different countries, 10 different countries, 5,000 heart failure patients specifically. You can see on the bottom right, you have the different severities of heart failure. So quite diverse patients, age 57. And again, it was randomized controlled trial, double blind. And let's go to the actual outcomes, next slide, and see what they found. So what they found was, quite intelligently, they divided the data in the peak season of influenza and compared it to the off season, so to speak. And they found that in regards to MACE, so cardiovascular death, non-fatal heart attack, non-fatal stroke, there was an 18% reduction in their data. In terms of death, same thing with the other studies. Death from all causes was reduced, death from the cardiovascular disease reduced, and pneumonia, 49%, as we can see, which is not very surprising. But we did not see strong evidence for preventing hospitalization for heart failure, at least not from this study. And if we go to the next slide, there have been studies looking at this. So this study was a systematic review analysis from May 2023, so quite recent, looking at some of the RCTs we mentioned in the previous slide and more observational study. To put it all together, they did find the same things: lower all-cause mortality, cardiovascular mortality, risk of stroke, but they did not find, in this study at least, any effect for heart attacks or heart failure hospitalizations. And then there's a systematic review after this, which finds something similar. The evidence seems to be weak for heart failure hospitalizations in the next slide. Slide 60. Yeah. Cool. Anyhow, I think we can skip this slide. It's okay. All right, RSV. So if you go to the next slide, we can see the effect. Comparing RSV with the flu, this is an interesting study. 645 RSV patients
So
comparing
RSV
to
is a
800.
different virus. What should you say what RSV?
It's a different virus.
It
Say
affects
again?
young and old people.
Yeah.
Go ahead.
Yeah, exactly. Young and old people. And essentially what they found was patients who were infected with RSV compared to influenza, they were older, they had more severe risk factors, COPD, etc. So it just tells you RSV is another virus you definitely want to avoid. And we're going to talk shortly after about the vaccine available for this, its cost, its availability. Just remember the risks. It's a good comparison of RSV seems to be a little bit worse than the flu for people at risk. Okay, let's go to the next slide. All right, just key takeaways on the flu and heart failure. This is a bit of a summary slide. So as we mentioned, the damage can be done by different mechanisms. Again, the mechanism is not the most important for us right now, just directly or indirectly, it does damage. Damage can be done by influenza, RSV, bacteria. And in terms of heart failure hospitalizations, reducing it from influenza vaccine, the evidence seems to be weak for that. When you look at the totality of the evidence, everything together from just biological rationale, plausibility, observational study, RCTs, we saw that flu vaccines do reduce heart attacks, strokes, cardiovascular deaths. Again, as Dr. Curnew mentioned, that study in 2021 that changed your practice. That's a good example, along with the others RCTs and the last one from McMaster. But again, future RCTs, just going to raise your confidence, just to reiterate the confidence idea. The science is all about a spectrum of confidence. Okay. Next slide, please. All right, let's talk about vaccine schedules. Pass it off to Jimmy.
Okay, thank you so much. So Thank you for all of that. I think all of the information about infections, how they take hold, and what are the most important ones for people with CHF are very relevant information. So now we kind of want to segue a little bit into the most important vaccines that have been introduced already, as well as their cost in Ontario and who is covered, and then lastly some prevention tips. So what we can see here is kind of like a summary table for the vaccines that we've talked about. Um, and you can definitely feel free to take a screenshot of this for your own personal reference later on, because we know they are very important for you. So the first one for influenza, we have been touching on it a lot previously, but we know that in people with CHF, obviously there is a sort of compromised immune system, as well as that brings along with it like a risk of more serious complications from the infections. And influenza infection may kind of induce, in worst case scenario, acute decompensated heart failure response. So this can be very detrimental and lead to hospitalization and very potentially even fatal impacts. So influenza vaccines are very important for that reason. And in Ontario, they're typically offered for so children who are 6 months or older, and they are available for free. So at your local pharmacy store or the family doctor's office, I'm sure most of you have gotten an influenza vaccine before, so definitely keep that in mind. And then the next vaccine category that we kind of want to touch on are Prevnar vaccines. There is also one separate one, which we'll talk about. It's called Pneumovax 23. But for the Prevnar vaccines, there are 2 different types, 13 and 20. So these are actually conjugated vaccines that are meant to kind of combat those pneumococcal infections that we've been talking about in this presentation. And for people with CHF, of course, they can exacerbate lung function and also cause conditions like pneumonia. So that can be really bad because people with CHF tend to already have kind of a compensated lung function. So in Ontario, so usually the coverage for Prevnar vaccines, so 13 and 20, are infants or children beginning at 2 months, as well as older adults. And for the Prevnar 13 vaccine, it can be purchased on an individual basis for seniors who are 65 years old or older. But for a very specific range of adults who are at high risk of pneumococcal disease, it will be free. And we'll kind of put a link in the description box so you can see what kind of classifies as high risk in this case. Moving on for Prevnar 20, the range will actually be around $140 to $150 for each one, so it is actually not covered. And the other vaccine kind of that fits into this category but is different that I was talking about is called Pneumovax 23. So in comparison to the other 2, which are called conjugate vaccines, the Pneumovax 23 vaccine is actually called a polysaccharide vaccine. And generally speaking, the conjugate vaccines are better because they are more durable and also longer lasting in protection. So this has been kind of found to be true based on a lot of studies. So we wanted to point that out, but also note that the Pneumovax vaccine is still free for seniors who are age 65 years old or older. And for the COVID-19 vaccine, we have definitely seen also in many studies how it can lead to myocardial damage and respiratory complications. So in Ontario, it is offered to anybody age 6 months or older. And as we know, the cost is covered publicly, so it is free.
So thanks for sharing that. If you just go back to this over here, so who should get influenza vaccines? I think you can argue that anybody 6 months or older should get it. Same thing with COVID-19. We can argue about the frequencies about this in different risk categories. And you see, and the alarming data is that these vaccines these diseases actually damage our insides and your body repairs itself. And when it comes to Prevnar, now we didn't talk about pneumococcal bacteria today, but one of the game changers is I had my tonsils taken out when I was a young little boy. That disease has gone away. And what happened is pneumococcus, the bacteria, goes and resides in your nose. And it leads to tonsils, a lot of ear infections, a lot of tubes were put in people's ears at one time, and a lot of tonsils were taken out. This vaccine has eliminated or decreased that dramatically. And most kids that get 3 vaccines when they're young in life, and those vaccines are probably good for life. And you probably don't need any more vaccines when it comes to that. COVID is not a good for life vaccine. The other interesting thing is that the Ontario government, something called Pneumovax 23, that means it carries 23 different types of the bacteria, but it's not a long-lasting vaccine, and it's not a great vaccine. Prevnar 13, had Prevnar 13 last year when it was available, and I had to pay for that vaccine. Prevnar 20 is an improved version of that vaccine. It carries more serotypes. It really is not covered for most people in Ontario at this stage. That's always going to be revisited as time goes on, but I would consider getting that vaccine if you didn't get it in your childhood, and most of us adults haven't gotten that. So it's a good vaccine. Um, we always talk about the death rattle or the old man's disease or old woman's disease is that we die with pneumonia, and pneumococcal pneumonia is a very common bacteria that leads to that. So that should be considered getting at some point in time. And about COVID, it's evolving. So what I learned about COVID, think about those tires. You want bald tires or you want good tires? And vaccines or current generations of vaccines wear off over time, and you can discuss with your doctor the pluses and minuses about this. What really worries me about all these viruses and bacteria, they damage your inside, and your body has to repair itself. And does that lead to permanent damage? I think, we can argue these diseases accelerate blocked arteries, accelerate atherosclerosis. So, and we're still learning. And this is something great information. And just getting the flu shot changes mortality in people who have a heart attack coming to the hospital in this. And that's amazing. So thank you for sharing that. Next slide, please. Tell us more.
Yeah, thank you for your insights. Yeah, definitely I agree. Like our body can obviously only endure like so much wear and tear. So that's why these vaccines are so important. They're really like the first step of precaution we can take. So yeah, just moving on to this is like the last summary slide for vaccines that you can get. So there is something called the Tdap vaccine offered here. So this one is kind of offers protection against several different types of infections. So primarily against diphtheria and pertussis. So these are respiratory infections, which once again, for those of you with CHF and compromised lung function, you really don't want to be getting these. And also it offers protection against tetanus. So this is not necessarily respiratory related, it is actually nerve related, but it can be a life-threatening infection. So this is like a combination vaccine for all of those potential infections. The coverage range in Ontario is for adolescents to adults, and the cost is actually that it is publicly funded in adolescents and also free for one booster in the future. I think a booster is recommended after 10 years. So if you have not gotten that vaccine or you've gotten it in your adolescence, you can look into booking another booster for that because one of them will be free. And for the shingles vaccine next, like Dr. Curnew was talking about before as well, the kind of risk for shingles kind of gets heightened as you age. So especially for people with CHF, shingles could elevate your risk of future cardiovascular events, especially things like stroke and heart attack. There's been a lot of studies proving that it can make people more susceptible to these. So it's very important to look into that. And for Ontario, adults and seniors, usually aged 50 years or older, are eligible to receive the shingles vaccine. And the cost will be free if you are aged between 65 and 70. If not, and if you still need to get the vaccine, the out-of-pocket cost can be around $150 to receive it. The last vaccine we kind of want to touch on is the RSV vaccine. So Rad was explaining a little bit about RSV earlier, and this vaccine is relatively new. So I think it was newly approved in Ontario in fall 2023. So actually very, very new. And it can be very kind of detrimental and kind of dangerous for people with CHF, especially seniors who have compromised lung function. They can be at risk of severe lower respiratory tract infection if they do derive this virus or infection. So this is one to definitely look into. And in Ontario, it's covered for seniors who are 60 years of age or older. And there are some conditions in which it is offered for free. So if you're older than 60 years old, and also living in long-term care homes, elder care lodges, or some retirement homes, which have been licensed to provide dementia care services in the province, then it will be publicly funded for you. And if not, and you have to pay out of pocket, then the cost range can be somewhere from between $200 to $350, and that depends on where you live.
Well, that's wonderful for information for the shingles vaccine. I think you need 2 doses, and so I think it'd be $150 per dose if I'm not mistaken. But we can check the price of that and post that a little bit later. So these are the dream team for vaccines, especially to get older. We concentrate a little bit of congestive heart failure, but that's all cardiovascular outcomes. Um, I'm quite impressed with the power of vaccines, and I always think about is that. Man, isn't it better to prevent an accident from happening? Isn't it better to prevent an illness from happening? And these medications, and also more importantly, decrease the severity of that of that uh, of that insult. So if you skid off and one of the things is I made the mistake one winter. I didn't have snow tires. I slid off, and luckily nothing bad happened. If I had snow tires, I might have slid off, but it wouldn't have been as much damage. So vaccines are along that line of evidence. So they don't stop things, they actually prevent things. And the other thing too is that if you go back one slide to that Prevnar 13-20 vaccine, is that what happened is that what happened is that young kids got pneumococcus in their nose. They hugged their grandma and grandpa and gave them pneumococcal pneumonia and killed them. And what happened right now, that vaccine has changed infections. So it protected you from ear infections, throat infections, um, pneumonia, and also protected your grandparents, your loved ones from dying and having pneumonia as well. So there are 3 reasons to vaccinate yourself: is one, to protect you, to protect others, and to help decrease the amount of mutations of diseases and things of that nature. None of them are 100%, but they certainly soften the blow. So next slide, please. So those are my dream wishes for you and your vaccines. Tell us more.
Yeah, for sure. Thank you for sharing that. And could you just go back one slide? Just to confirm quickly, for the shingles vaccine, you do need 2 doses. So that's given as one series, and the 2 doses should be around 2 to 6 months apart. And it is, yes, $150 per dose. So together it would be around 300.
And for the RSV vaccine, is that so far it's a new vaccine. We believe it provides protection for at least 2 years. We don't know beyond that right now. So right now you get 2 years protection for the RSV vaccine, and we will learn how durable that vaccine is over time. Tell us more.
Yes. Okay. For this one, we kind of just wanted to summarize this systematic review that we found. So it kind of does a summary of the impact of vaccination against influenza, shingles, as well as pneumococcus, and how they kind of influence the incidence of cardiovascular events in the elderly. So in this study, they kind of found 33 studies related to influenza, 5 on pneumococcal vaccine, and 2 on the efficiency of zoster vaccine, which is for shingles. And we kind of wanted to show that they found, when they were looking at the impact of the herpes zoster vaccine, they carried out several analyses, and they found that for the magnitude of effects of the productive effects, it kind of reduced the it was very protective against cardiovascular events. So for stroke, it reduced the possibility by 49% in one study and then 16% in another one, which is quite a high number and a significant finding. So you wanted to introduce that, is that the herpes zoster vaccine is definitely important for cardiovascular protection. On the next slide quickly. But then we also wanted to kind of give a warning of a limitation. So earlier we were talking about like studies and their magnitudes of effects and things like that. In this systematic review, they actually found that for pneumococcal vaccines, the studies included produced very varied magnitudes of effects. So they did find some protective effects in some studies, but then in a lot of other ones, they found that there was no evidence of a protective effect. So this kind of indicates that there was a very wide diversity of findings, as well as a lot of discrepancies, and that overall kind of points to a high heterogeneity in the results, leading to a low confidence. So we just wanted to point out that sometimes like this indicates we should be wary about believing any set of data in its entirety. and the pneumococcal vaccines haven't been found to have like a very definitively or strongly associated protection against cardiovascular events. Okay, so this is kind of like the last segment of our slideshow today. So we kind of wanted to go through preventive strategies for infections. So of course, like the first step like of protection first and foremost that we've been talking about this whole time is vaccines. That goes without saying. So we want to remind you to continue updating your vaccines, paying attention to whether you need another booster or another shot. And please don't be complacent about this because vaccines really are effective. And a lot of studies exist to prove that. So that is the first strategy we want to share. The other ones we've kind of laid out in order of importance for you. So we definitely want to highlight the importance of socially distancing or limiting gatherings, especially during flu or outbreak seasons when you know that it's like nearing winter time, a lot of people are sick, or if you if you know that there may be gatherings that could cause you to be at high risk, avoid those if possible. We also wanted to emphasize the importance of optimizing your sleep. We know that a lot of times like sleep gets sacrificed for other things, but sleep really does play a very crucial role in maintaining a strong immune system. And we definitely recommend getting around 7 to 9 hours of quality sleep per night. And this is obviously because during our sleep, our immune cell activity is kind of enhanced. So our body produces a lot more of these things called cytokines, which later on help to produce a more robust immune response and fight off infections. And it also, during our sleep, our level of inflammation gets reduced. And chronic inflammation really has the ability to suppress our immune system and lower its ability to react quickly. So overall, repair and recovery, those are the main goals of sleep. Number 4, we kind of wanted to encourage you to be very mindful of your stress levels. So engage in techniques like meditation, deep breathing to stay motivated, and also definitely to care about your own body and health. We have a lot of videos on our channel also related to Motivation Club, which you might want to check out for that. But basically, when you get stressed, our body triggers the release of a stress hormone called cortisol. And one among the negative effects of this hormone is that it can lead to chronic inflammation that can be elevated over extended periods of time. And when that happens, inflammation negatively affects our immune system again and lowers our immunity. So along with sleeping well, make sure that you're also not stressed to help your immune system. And the last couple of techniques or strategies are more self-explanatory, but if you know that you're at high risk, please wear an N95 mask because compared to a normal surgical mask, which kind of just offers protection against things like droplets in the air or like spit, N95 does protect a lot more against airborne particles and viruses. So make sure to do that. And for number 6, we really encourage you to try to get close to your ideal body weight because a lot of studies have also been found showing that obesity has a pretty significant association with inflammation again, and also a state called oxidative stress, which is really bad and it can lower your immunity. So try to exercise as much as you can to get close to that ideal body weight. And lastly, we want to say to limit your soaking in alcohol. So of course, if it was up to us, we would say like no drinks is the way to go because alcohol is a type 1 carcinogen and it contributes to exacerbating your heart failure. So please try to limit these because you don't want to worsen the burden that you already have on your heart. And as we keep saying, we hope that with these strategies in mind, you can kind of stack the odds in your favor. Dr. Curnew, did you want to add something?
Go back one slide again. One of the things is if you think you might have COVID, test yourself. Test yourself multiple times. You don't want to make other people sick and wash your hands and try not to touch your eyes and your face and things of that nature as well. During the height of COVID, we were very careful about goggles, not touching your eyes, proper gloving techniques, and all my clothes used to go in a garbage bag and directly into the washing machine away from other family members and things of that nature. But these are predominantly airborne viruses. Best time to have family gatherings is outside. You're 35 times less likely to infect others or infect yourselves, or if people are have infection. There's some data that these HEPTO filters and better ventilation makes a difference as well. So we use them at the office, and I encourage you to use it at your home too as well. And be careful. There's a ton of COVID out there. Christmas, holiday season, happy Hanukkah, happy Christmas, happy New Year's, but we'll have to watch out and see, how many sick people are out there and be cautious. This year we decided to cancel our Christmas party for staff and just give people some extra money to enjoy with their families and loved ones. And so you decide what's right for yourself. And I'm not saying I know all the answers, but you got to try hard. And if you think you're sick, keep away from others and test yourself. Next slide.
Yeah. Lastly, we kind of wanted to share some more self-explanatory tips that are kind of promoting just a healthy lifestyle habit in the natural remedies, because these are like honestly the most sustainable tips that we can offer. So number one, focusing on healthy eating and nutrition, eating like a balanced diet that's rich in fruits, vegetables, as well as lean proteins and whole grains that can really support a healthy immune system. Also, when you're doing that, try to avoid your salt intake. So limit that to like 1,500 milligrams or less a day to improve your heart health. And also make sure you're getting your vitamins. Vitamin C is one of the biggest kind of protectors of our immune system. So try to get that from foods like red bell peppers or oranges or broccoli or other fruits. And on top of that, try to exercise regularly to improve your circulation and also distribute immune cells throughout your body. And like Dr. Curnew was saying, maintain your hygiene and cleanliness to fight off those infections, because kind of like today's habits really do have the ability to shape tomorrow's health.
Well said. And remember is that the vitamin C data with IV infusion of vitamin C doesn't work. Mother Nature has a secret formula, and when we try to give you a vitamin cocktail, we mess it up. So the advice you give is, get a healthy immune system, get proper sleep, proper exercise, keep your mind in good place, get that weight down, and work hard at it. And happy holidays and happy vaccinations and happy good hygiene maneuvers and safeness, and wear masks in high-risk situations and avoid situations that you think are risky. Thank you. And get your vaccines. So
Oh,
these are
right.
some
This
of
is
our-
just the playlist. Yeah, go ahead.
Oh, these are some of, so we have some playlists and heart failure, other areas as well. Just go for it and just take a look at that. So in God we trust, everything needs data. This is something is in one sense, this is a complicated webinar. We talked about pathophysiology. For some people, it gives them a headache. For some people, they love a good understanding of this over here. So please take the time. And you mentioned good sleep. If you look at a webinar, we'll put you to sleep, and that will help. So I want to thank the entire team for such a wonderful presentation. And I want to wish everybody a very happy, festive season and a healthy one. And 2024, I'm going to work hard at getting my weight down, improving my sleep, being a more caring, nicer person, and learning new thoughts and keeping my vaccines up to date. And I want to thank the team for a wonderful evening. Thank you so much.